Welcome. A large university campus within 4 hours of eating lunch at the main cafeteria, 15 students present to the campus health clinic with nausea, vomiting, and abdominal cramps. 3 students have mild diarrhea. All have eaten a salad containing pre-baked leafy greens, grilled chicken, and a creamy herb dressing. As a public health laboratory scientist, you need to quickly identify whether a bacterial toxin from Staphylococcus aureus or E. coli is present in leftover food sample or student stool specimens. Which rapid, sensitive, and cost-effective method would you use to screen for the suspected toxin, and what are the critical limitations you must consider before reporting a positive result? Let's walk through the cafeteria outbreak scenario. You suspect a pre-formed bacterial toxin because symptoms appear within hours. Mass spectrometry is accurate but slow and expensive. Instead, you choose a toxin ELISA. Why? First, you prepare sample from leftover dressing and the chicken, then add them to a microplate pre-coated with toxin-specific antibodies. Second, if toxin is present, it binds after washing. You add an enzyme-linked antibody. Third, you add substrate. A color change means toxin is present. However, and this is critical for your students to understand, a positive ELISA alone is not definitive. Look, cross reactivity can cause false positive. Also, the creamy dressing might cause matrix effects interfering with antibody binding. So what you learn, the toxin ELISA is an excellent screening tool, but confirm positive result with the second method like LMS. Never rely on ELISA alone for critical or large legal decisions. According to the case, which of the following is an example of bacterial toxin detected by ELISA? Aflatoxin, ricin, toxin, Clostridium difficile toxin. In a toxin ELISA, what causes the final color change? Binding of toxin to the plate, washing away unbound material, and enzyme cleaving substrate, addition of patient serum. Which limitation of toxin ELISA is most likely to produce a false positive result? High sensitivity, matrix effect, cross reactivity, and limited toxin. True or false, toxin ELISA can detect multiple different toxins in a single test. False. Each kit is designed for a specific toxin. Spectrophotometry is used to measure color intensity in a toxin ELISA. True. Mycotoxins like aflatoxin are produced by bacteria. False. They are produced by fungi. Name 2 advantage and 2 limitation of toxin ELISA based on the case. Advantage and disadvantage. Advantage: high sensitivity, specificity, quick, easy, cost-effective, versatile. Limitation: cross reactivity, matrix effect, and limited toxin scope. In the cafeteria outbreak scenario, why might a toxin ELISA give a false negative even if a toxin is present? possible reasons matrix effect from creamy dressing or other food component interfering with antibody binding. Using an ELISA kit designed for a different toxin than the one actually present.